Severi sepsis and sepsis shock. Sepsis was recast as systemic infection often described as blood poisoning and assumed to be result of the heart invasion by pathogenic organisms that then spread in the bloodstream. Severe sepsis and sepsis shock. The term severe sepsis to describe instance in which sepsis is complicated by acute organ dysfunction, and they codify sepsis shock as sepsis complicated by either hypotension that is refractory to fluid resuscitation or by hyperlactemia. Incidence: age, sex, and race or ethnic groups. Infants and elderly persons higher in males than in females. The incidence of severe sepsis depends on how acute organ dysfunction is defined and whether that dysfunction is attributed to an underlying infection. Severe sepsis occur as a result of both community-acquired and health care associated infections. Risk factors and causes: the acquired immunodeficiency syndrome, chronic obstructive pulmonary disease, many cancers, use of immunosuppressive agents. Causes: pneumonia, the most common cause, intra-abdominal infections, and urinary tract infections. Blood cultures: Staphylococcus aureus and Streptococcus pneumoniae are gram-positive isolates. Escherichia coli, Klebsiella pseudomonas rufinosa are negative isolates. Clinical features: fever, hypothermia, tachypnea, altered mental status, elevated heart rate, leukocytosis, leukopenia, arterial hypotension.